can be aspiration. Understand? Dry only after clear of airways. Then, after dry, what do you do? After dry, you answer on your question. Baby breathing or not? If newborn not breathe, if apnea continue, you do tactile stimulation. You do tactile stimulation. There are 4 methods of tactile stimulation. I take, then I do click on the heel. Second, first, second, third, massage of the back and anterior count. After tactile stimulation, you repeat your question, baby breathing or not. If after tactile stimulation apnea continue, apnea, this is indication for step B. If apnea continue after tactile stimulation, you start step B. But if after tactile stimulation baby start breathe, apnea absent, you check heart rate. You check heart rate. I look in on the watch which present on your visual line, and you check heart rate in 6 seconds. This is 1/10 of minute, and then you plus only 0 to this number, which you check in 6 seconds, and you have result heart rate. Yes. If heart rate less than 100 per minute, what is it 100 per minute? This is less than 10 per 6 seconds, in 6 seconds, yes? If heart rate less than 10 in 6 seconds, if heart rate less than 100 per minute, this is second indication for step B. But you remember, general aim of neonatal resuscitation, this is prophylaxis of hypoxical complications. That is why if present apnea after tactile stimulation, you immediately start step B without result of heart rate. If apnea absent, you check heart rate only in this situation. Understand? Then, beginning, thermal control, correct position, then
Clear.
what do you do after clear?
Dry.
Then
Check whether
Breathing or not.
yes. For example, start breath. Do you do tactile stimulation? Not. What do you do?
Check heart rate.
11 and 6 seconds. What do you do?
Oh, आपका इसके no.
छोड़ दो.
You not finish step 8 because last moment in step 8. This is oxygen therapy if necessary. What is if necessary? If present central cyanosis. Now you check cyanosis present or absent, and if cyanosis present, you can increase concentration of oxygen in air, but newborn can breathe by self. You can use resuscitation bag with mask, with oxygen system, yes? But not press resuscitation bag because newborn breathing by self. Now this isn't step B. Newborn can breathe, but you only increase concentration of oxygen in air. Or through only mask with oxygen tube, or if this is oxygen tube, you pass oxygen through oxygen tube near mouth, yes, and but newborn breathing by self. 3 variants of oxygen therapy here, without artificial ventilation. Second variant, thermal control, correct position, then clear of airways, then dry and
Checking of signs.
what?
Checking whether breathing or not. And sinus.
Not breathe
Not breathe, then tactile stimulation.
Tactile stimulation.
after tactile stimulation.
Again check whether apnea present or not.
Again, we have to check.
Absent.
Step B.
Then
Step B.
Absent apnea.
B.
2 in 6 seconds.
B. Step B.
Heart rate.
It's 2 in 6 seconds.
Then
Step B.
no.
Step B करना पड़ेगा ना?
D तो करना पड़ेगा ना.
2 in 6 seconds. What do you do?
Step B.
Oxygen.
B. Okay.
Step B.
If 12 in 6 seconds.
Then
What do
Check
you do?
sinus is step for.
Absent.
Step B
then
then.
Absent. Sinus.
then C.
छोड़ दो मुझे.
Then we can go to step.
Do you do step B?
No.
No. Absent indication. What do you do? Contact skin to skin with mother if absent contraindication for this contact. If mother with acute form of tuberculosis, you can't use this contact. If mother with AIDS, contacts present but breastfeeding absent. Different situation. Yes? Next. If present indication for step B or apnea after tactile stimulation or heart rate less than 100, it start breathe after tactile stimulation. You can do in step B artificial ventilation must do through resuscitation bag, through mask or through endotracheal tube. You can unite endotracheal tube with resuscitation bag too. You learning how do through mask. One hand fixed mask. You stand near newborn as I now, near side or near head. You can't stand here. This is professional mistake. One hand fixed mask. Under mask, you must see and nose and mouth and chin without eyes. You use different mask according to size of newborn. There are 2 forms of mask, round form and anatomical form. If this is anatomical form, this is place, this is angle for nose. Yes, this is correct position of mask. This isn't correct position. This isn't correct position. This is correct position. This isn't good variant because this is very small for this size of newborn. Only here you can use one hand fix and you press resuscitation bag with physiological speed. Respiratory rate in this age approximately 40 per minute, and with this speed you do compressions of resuscitation bed. 40 per minute, but this step continue only half minute. And special rhythm as dance waltz. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. And our eyes are looking on the chest because movements of the chest, this is criterion of correct artificial ventilation. Correct position. Убери ручку. Видели? My eyes are looking on the chest because movements of the chest this is criterion of correct artificial ventilation and criterion of effectivity if cyanosis decrease. Sometimes artificial ventilation correct but without effect. Then, after 30 seconds of step B, you check heart rate. Here 2 indications and number 100. After A, 1 indication, heart rate, and number 60. If after 30 seconds of step B, heart rate less than 6 in 6 seconds, this is indication for next step. Okay. Please, you do artificial ventilation. Please. 1, 2, 3, 1, 2, 3, 1, 2, 3. You do here now. Please continue. I check heart rate. If heart rate less than 60, this is indication for step 2. But you pass air in lungs and in stomach. And if we have indication for step C, in step C we continue artificial ventilation too, and we continue pass air in stomach too. And you must enter endogastral, not endotracheal. This is endogastral tube. Now I measure. First point, bridge of nose. Second, earlobe. Now continue artificial ventilation. Third, processus xiphoideus. I must enter endogastral tube through mouth on this distance. Now, continue. Evacuation. And now stop. I general doctor in this situation. And 1 and 2 and 3 and press. 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 Sit down. There are 2 methods of cardiac massage. Method of 2 hands and method of 2 fingers. Method of 2 hands together and method of 2 fingers. But here your fingers too. You do pressure. If this is sternum and this is processus xiphoideus, you do pressure on the lower third of process of sternum. Now I fix with processus xiphoideus here and do pressure on this part and lower third. Here, lower third, because heart localized here, and indication for step C, heart rate is less than 60. Normal heart rate, which characterizes for newborn. You remember, according to Apgar score, if heart rate after birth more than 100, this is good, yes? But normal heart rate, which characteristically for newborn, 120 to 140 for full-term newborn, 140 to 160 for premature newborn. And if heart rate less than 60, central hemodynamic not effective. And due to actions of your hands, of your fingers, you do artificial systolic. And if you do pressure in different parts, here fraction, here you do pressure on the lungs, here you do pressure on the liver and sternum, yes, not on the heart. And important, if deep of this movement, 1/3 of anterior posterior distance. If the chest, for chest characteristically round form, 1/3 diameter, yes, of the chest. And important, if vector of force of your pressure maximal central and maximal perpendicular, because if I do pressure as I know, I press only lungs, not heart, and systolic absent. If I use this position of my fingers, vector of force here, and I compress only this part without heart. Then demonstrate on your hands. If this size of your hands small, particularly if size of newborn large, you can't use method of two hands because
Won't
your
reach.
finger can't unite here and your cardiac massage can't be effective. You must use in this situation only method of two hands, fingers. In other situations you can use method which do you prefer, not important. Both methods effective, but if you have small hands and large newborn, only method of two fingers. If very different size of your fingers, during many practice, you can use this method. With the noise, can't. Tomorrow I will inspect your practice. You can't do cardiac massage. Understand what you must do at home now. And speed between pressure on the chest and compress of resuscitation bag. This is 30 compressions of resuscitation bag to 90 press on the chest per minute. Together 120 manipulations in 1 minute. In each seconds you do 2 actions. Understand? We work very quickly. And 1 and 2 and 3 and press. And 1 and 2 and 3 and press. And here on this mannequin we can you can take normal practice according to this deep, according to localization of your pressure, according to vector, according to speed. If together your actions is correct, here you see 3 green lamps. Now, according to my voice command, now this is processus xiphoideus. And 1 and 2 and 3 and press. 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 Yes? Deep speed proportions. After 30 seconds of cardiac massage with artificial ventilation, I check heart rate. If heart rate less than 60, we use drug. This is epinephrine. 1 milliliter of epinephrine plus 9 milliliters of physiological solution, natrium chloride. And you have 10 milliliters of new solution with concentration 1 to 10 thousandths. And you use dosage 0.1 to 0.3 milliliters, looking here, per kilo. How many milliliters of epinephrine you will use for this newborn?
0.3. It's
Why?
about 3 kilogram. This baby.
No, no, can't be true. Can't be true. This is large newborn.
Maybe 4.
You not measure.
Yes, no.
You will measure birth weight after 2 hours after birth for prophylaxis of hypothermia, and you check birth weight visually. According to size of this newborn, my proposed birth weight more than 4, less than 5. This newborn more than 3, but less than 3.5. This more than 5. Approximately 5, maybe more. How many?
0.4.
If more than 4, must be more than 4 and that is why I recommend minimum 0.5. Yes? Because if you divide on the wage, minimal dosage will less than 0.1. Yes? 0.5, maybe 0.6, 7, 8 here.
3, 4.
Better minimum 0.4. Because if you divide on weight, less than 0.1. Here.
6.
And
Minimum
0.6. And 1 can be 2. And 1 can, here 1 can be 2. If you use maximum dosage. Okay. After you enter epinephrine through umbilical vein, through catheter, umbilical vein, you do catheterization of umbilical vein, and through this catheter, intravenous maximal quickly, you enter epinephrine, and after you continue step C and step B together. And 1 and 2 and 3 and press. 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 After 30 seconds, I secondary check heart rate. If heart rate less than 60, we continue. And 1 and 2 and 3 and press. And 1 and 2 and 3 and press. And 1 and 2 and 3 and press. 30 seconds. I check heart rate. If heart rate less than 60, and 1 and 2 and 3 and press. And 1 and 2 and 3 and press. And sit down. And you use new portion of epinephrine after 3 to 5 minutes after first pushing. And after each 30 seconds, you check heart rate. If heart rate less than 60, you continue step C. Neonatal resuscitation continue maximum 10 minutes. In this period, you can use epinephrine 2, maximum 3 times. After 10 minutes, this neonatal resuscitation can deform in intensive therapy if newborn need of intensive therapy. But if you use STD2, I assure condition of newborn very difficult in need of intensive treatment. Have you a question for me?
No.